pleasure of being here this afternoon with Dr. Danuta Hoyer and Dr. Vesna Skul, who are the co-founders of the Comprehensive Center for Women's Medicine in Chicago. They are not only just extraordinary human beings, they are also brilliant and very compassionate physicians. They have been voted top internists in the United States, top women's doctors in Chicago, and I have had the good fortune of knowing them for 10 years. And thankfully, they came into my life when I actually was suffering quite a bit with my health. And I am now vitally healthy, and it is due in great part to their amazing care. And I also have to say the love that they offer. They are very well loved, obviously, by their patients, and combined probably have seen over 10,000 people. They've been in practice for over 30 years and have always been ahead of the curve. They have always been trailblazers, and also both were referred to many years ago as granola docs. So they were practicing integrative medicine before it was called integrative medicine. And so it's very important that we hear from them at this time because they have incredible wisdom and obviously are visionaries. So we thought it would be great if the three of us could gather and you could learn from them today. So, so ladies, anything else you'd like to say as an intro before we get started? Okay, we're about to have a lot of fun. So the two of you have been seeing patients via telemedicine for over a month. And do you now have any COVID-19 patients that you have managed supporting them outside of the office, obviously because you're not seeing those patients in person?
So Julie, between Dr. Hoyer, Danuta, and myself, we probably have over a dozen patients with a diagnosis of COVID-19. And I would dare say probably as many, if not more, that are dealing with some challenges of unusual, mysterious illnesses that are lingering that we just haven't been able to identify by testing as COVID. I am very happy to report that actually among my patients, none of them had been in the hospital, and Danuta had one who with a short stay in the hospital setting, and they're all recovering at home. I believe doing better than the general population because all of our patients have been attracted to our way of life and practice, our granola way of practice, and have been supported by education about nutrition, lifestyle, and taking some supplements that have helped them support and immunomodulate. What I mean by that, my sickest of the 4 patients with COVID is a woman who is now completely recovered, but by the traditional definition would have been a hospitalized, possibly ICU patient, 67 years old, hypertension, asthma as comorbidities, but prior to getting ill on a steady, supportive regimen of nutritional supplementation, which has allowed her to weather this whole spectrum of symptoms. She exhibited every last one of them in a manner that wasn't easy, and it wasn't easy to support somebody this way who lives alone and was at times feeling discouraged and ill. But we amped up the immunomodulation by increasing her nutritional support to allow the immune system, which consists of 2 arms that need to be in balance, to become in balance. And what do I mean by that? Well, in this particular virus, which is a novel virus, we don't really recognize it. Our immune system is not there ready to get at it because it's seen it in the past. the immune system has to really mount a completely de novo response of handling it. And not only do we have to engage it in that in that process, but the virus is so, we say virulent, so incredibly powerful to attack our cells, that in this process, even if the immune system is recognizing it and creating all sorts of biochemical compounds, a lot of inflammation occurs on the cellular level. So, people who are not prepared for that end up with primarily inflammation in their lungs and inability to exchange oxygen through their blood on respirators, and unfortunately many succumb. But the patients whose immune system is robust to begin with are certainly handling this whole situation a lot better. So not only do we need to have in our bag of tricks, if you will, or our medicine cabinet or nutritional supplement cabinet, a product that can survey, find, grab onto, and excrete a pathogen, such as one of the recommendations that we make to our patients, but we also have to have the ability to sort of quench down the cytokine storm or inflammatory storm with a good nutrition and antioxidant nutritional supplements. So when people get sick, they really don't feel like eating the best of diets. So the patient in question that I'm describing had been supporting herself through a lot of, good hydration. Chicken soup has an antiviral properties, but among the liquids, consuming an antioxidant rich beverage that actually allows to neutralize the free radicals and the cytokine storm components by ultimately then clearing all of that through our gut and, achieving a doable and ultimately treatable condition. Not fun. None of them had fun, but they're all now on the way to recovery.
Such good news.
So I think that key is really to provide to our bodies nutrients and support that they need, because our bodies have their innate intelligence, which allows us to heal if we have the necessary support on board and consumed through our good diet and nutritional supplementation.
Well, again, we're so very fortunate that you're here in Chicago, and now that you're doing telemedicine, both of you, people can get in touch with you all over the United States, right? So, and therefore you can help so many more people. I know, Dr. Hoyer, you are multi-talented and have many, many interests, but one of your passions really, and I love listening to you talk about this, is gut health. And I'm obviously a layperson, but my understanding is that COVID-19 really attacks the respiratory system. So can you speak about the relationship between gut health and the, how that plays a role in supporting the respiratory system?
Thank you, Julie. First of all, COVID-19 has become sort of metamorphosizing in front of our eyes as we learn more about it with each passing day. It is a multi-system aggressive virus. And if you think about the GI tract, it's basically like our first line of defense. If you line up all the cells from your mouth to the rectum side by side, their surface area is equal to a tennis court size. So it's a huge absorptive surface, and we have a huge amount of lymphoid tissue called GALT, gastrointestinal lymphoid tissue, that helps that thin mucosal layer, that thin skin, if you will, that lines our GI tract, helps with not only absorption of nutrients, but also trying to keep the invaders out or at least alarm the system so that we know the invaders are coming in and start mounting a response. So our GI tract has been maligned with the standard American diet for years, for decades. We do not eat a whole food, plant-based diet for the most part in the United States. The advent of GMO foods, pesticides, glyphosate, all the other offenders that make our food supply suboptimal are probably in some way causing such a high mortality rate in the United States as opposed to other countries. I think that information will come out in the next months and maybe years to come, but that is one of the things that most environmentally sensitive physicians and observers are beginning to think about. So how do we optimize our GI tract to this assault? Well, you try to digest the food you're eating better, and you have digestive enzymes. You try to have both probiotics, which is a multiple streams of good bacteria in your gut, that is your second immune system, so to speak, but also they need to survive with foods called prebiotics in order to survive. And you need good elimination so that you can daily detoxify. Because if you don't have good elimination, all the toxins that you have in the GI tract that you want to get rid of will be reabsorbed in the gut and go back to your liver and go back into your system. So if anybody thinks that having a bowel movement once every 2 days is normal, that is not normal. We aim to get people to basically have an elimination at least twice a day, have large, good bowel movements, lots of fiber in the diet, lots of natural fiber, etc. So we try to supplement people that have, we try to supplement people with those good bacteria. You don't need billions and billions and billions of organisms. You need a combination of good organisms that are do not require refrigeration, so you can remember to take them. We give digestive enzymes so that you can break down the food into bite-sized pieces so they're absorbed better. And all of this is together in a product that we give our patients. So those kinds of things help elimination and the first line of defense, if you will.
Thank you. Oh my gosh, Danuta, it's wonderful. And so a lot of people are talking about how can we tell if we are infected or not infected. Can you discuss that for a moment?
First of all, I have to tell you that when Vesna was mentioning the patients that we have with COVID, at the very beginning, they were calling with the classic symptoms, but we couldn't even test them. So we have a whole population that we know had it, but we haven't even had it proven it. Then we have the cases that we sent to the hospital for their swabs. They came back and they stayed at home and they recuperated. What people need to know is a positive test is a positive test, great. But a negative test has a 30% chance of being wrong. So if you take 10 people who have a negative test and are thinking, oh great, I'm great, but they have all those symptoms, that's why they went to get tested to begin with, that means 3 of them got a false negative, which means they're really positive, okay? So in that realm, all of us have to be careful about continuing to be isolated in our homes with our families and continue to pretend, even if you don't have symptoms, they could be carrying it, because up to 25% of us could be asymptomatic carriers. And I'm very dismayed at the amount of protest is going on right now against this quarantining, because if one looks at some of the curves in different cities from the Spanish flu in the early 1900s, people reached a peak, the peak fell, people went out of their homes and started congregating, and a second peak came that was higher than the first. So it's very important for people to continue the way we've been doing it. It's hard, it's sometimes boring, but there's lots of ways to contribute. If you have any inclination to give blood right now, you should go online. Heartland in the Midwest is who does blood drives. They're not able to do blood drives in community settings now because nobody is in community. So I think that's one thing one can do, and there's a host of other places to go volunteer time and effort and funds.
Thank you so much, Danuta. So important for people to have that information, and you've just laid it out so clearly. I'm so grateful. So another question. So we know that sleep is one of the most important mechanisms of cellular repair and healing. And we've been hearing so much about, sleep hygiene and improper sleep. And even though during this time some people may have time to sleep, but there's also enormous stress, right? So that's so high during these times. So how are you encouraging your patients to, to have a deep, healthy sleep during this time?
Well, I think, Julia, you mentioned the importance of exercising good sleep hygiene. Even though we are, with all this time on our hands and people are drawn to, staying up late and doing work, because those of you with younger families are assuming roles of home schooling teachers while you're trying to work remotely at home. So come nighttime, now you have time to catch up and do things. And you don't have to get up really at 6 o'clock in the morning necessarily to get ready for the next day. So you allow yourself additional time to stay awake. Try to not do that. Try to respect the same kind of rules that you are trying to impose on your children so that there is some semblance of normalcy and there is some routine and rhythm that's going on. And while it's difficult for many people to sleep well, even during the normal circumstances, the stress of uncertainty of this situation certainly makes it a lot more difficult. So, returning back to some real basics. Who takes baths these days? Nobody has time to do that. So take a relaxing bath. Use some Epsom salts, has magnesium in it, which can transdermally penetrate through your skin, relax your muscles. Drink a magnesium-rich tea or beverage that does the same thing, relaxing you. Listen to some calming music, meditate. If you have never tried it, just simply doing some breath work and breathing exercises can bring about a sense of calm and get you to a place that should be dedicated only to sleeping. Sounds sort of crazy. Your bedroom should be that place, but we have converted a lot of our bedrooms to, stay-at-home offices, etc. Really try to isolate a place in your home that you're just using for sleep. Keep it nice and cool. Keep the shades drawn and dark so that natural melatonin and serotonin levels are in balance, which are so important to conducive to healthy sleep. Take some melatonin if you feel that you can't really get to sleep easily. Combining it with L-theanine, a natural amino acid which produces a sense of calm, is a beautiful way of sleep induction. For years, we've been sharing with our patients the importance of supporting the hypothalamic pituitary and end organ adrenal endocrine axis. When that is out of line, it is very difficult to achieve a sense of calm and support your nervous system or your endocrine system. So using ingredients that provide food for the pituitary to sort of balance it out and non-hormonally support our hormone system, but also help with healthy sleep through and particular ingredient called gamma-aminobutyric acid, or GABA, can allow us to not only drift to sleep peacefully, but get good 7 to 8 hours of restful sleep, during which time, as you point out, Julie, a lot of cellular repair occurs. And combining that with immunomodulating ingredients of moramylpeptides and beta-glucans and calcium D-glucarate, which I prefer taking the majority of at night. Those beautiful ingredients then help us detoxify and get us ready to excrete the toxins, both from our body, but it is also now known that our brain actually has a process whereby at night a lot of toxic chemicals are released and then can be processed and excreted in the morning. So combination of those, I think, will provide us with sort of end of day comfort and relaxation, ready to get on with the next day. And in this situation, really there are no magic bullets. It's just, as Danuta was saying, being respectful of what is going on around us and practicing social distancing while remaining close to one another through forums just like this one, and looking forward to hopefully at some point restoring some sense of normalcy.
Well, both of you are radiantly healthy, so a wonderful example for the rest of us, and certainly so many fantastic, just a really solid game plan that both of you have just offered to all of us. So are there anything else you'd like to add in summary? Yes.
So it's springtime, right? And gosh, in the 5 weeks of indoor time, we've all cleaned our closets 10 times over.
Hopefully.
How about cleansing our own bodies? I think that, people are either going to emerge out of this back to social settings like beautiful butterflies, cleansed, more fit, etc., or there could be challenges. And you've all seen the cartoon, start the at-home quarantine fit and trim, and ended not so fit and trim. So my only recommendation would be, as the fridge is becoming devoid of supplies, just go on a 5 or a 10-day personal cleanse and really reintroduce the whole plant food based dietary regimen, so that we are doing this as a new season has started, remembering that the recommendations that we've talked about are not just here for an acute battle with this virus,
Right?
Here to be implemented as an ongoing part of life, because this thing is not going away. It may be attenuated, but as you've all heard, it is very likely here to stay, re-emerged, we don't know when, likely in the fall, etc. So I think anything we can do to improve the robustness of our own immune system and improve our health is going to help us in just dealing with those challenges now and in the future.
And I know Danuta and you both are incredible chefs. So you did touch on an anti-inflammatory diet. So lots of whole foods, different colored vegetables if possible. And I mean, what I'm noticing among, my friends all over the globe actually is this level of stress, financial stress, a lot of uncertainty. So eating a whole food, plant-based diet does help very much so, right? And all of your other recommendations too. I mean, I think.
And also I think keeping it light to some extent. I sent you both an email yesterday. A friend started, I don't do chain letters typically, but she started something really cool. And that is to think of a healthy recipe and email it to first of the two people on the email chain, and send it BCC or 20 of your friends. And before you know it, you'll have 36 new healthy recipes. So I think we all need to do something with some levity, but also a great deal of focus on staying connected and sharing the love.
Absolutely. And as you said, the humor too, really to stay lighthearted and make sure from that place of lightheartedness, we are supporting our loved ones and also, the bigger picture as well. So Dr. Hoyer, anything in summary that you'd like to share as well?
I would say, in addition to everything that's been said, there are good nutraceuticals that are pharmaceutical grade, which means you basically get what is printed on the label is exactly what's in the bottle, unlike a lot of unregulated nutraceuticals. And you can maintain and help your innate immune system fight as much as you possibly can with a product called Immune. You can add antioxidants in the form of OPC, which are oligomeric proanthocyanidins. Think of all the most deeply colored berries and fruits, and then some. You can help your GI tract with a combination of digestive enzymes, pre and probiotics, and serrapeptidase in the form of Ease, which is just a small capsule with a meal once or twice a day. To balance the hypothalamic pituitary endocrine system, there is a spray called Otropin, which is sprayed under your tongue twice a day, morning and evening, on your nightstand. We, in addition to that, want people to take high quality omega-3s, because every cell membrane is made up of good fat, and you have to have good quality fat in your diet in order to make good cell membranes. In addition to that, there's zinc. And I know that all the zinc is off the shelves for the most part, but you can still find some. Zinc, when it is actually placed into the cell, helps stop the virus from dividing and replicating, which is why that's important. And most of us are zinc deficient as well. Add to that a good multiple vitamin with minerals, a whole food, more plant-based diet, and rest, and some daily physical activity. If you're cooped up in an apartment, you can go online or watch a PBS channel or something on your TV screen. If you have the luxury of going outside, go walking and go back in and go walking again. And keep your distance, wear your mask, wear your gloves, and stay very well hydrated.
Thank you so much. Thank you so much to both of you. I just know how dedicated you have been all these years to really supporting women and of course men as well in just being very, very healthy and therefore having a greater quality of life. And you have done miraculous work. And now, I've referred all of my friends of friends to you. And now again, as I said earlier, we have the benefit of you both offering telemedicine. So if anyone has any questions, you can go to their website, which is www.ccwm.com for the Comprehensive Center for Women's Medicine, again in Chicago. Their recommendations for the nutraceutical products are on their website. You can also look at their blogs for additional information. And even though we're all over 50, they do have a fabulous Instagram account. And so that's available as well. You can check that out. And just please know that the three of us are sending all of you, each one of you who is watching this, an enormous amount of love and our prayers. And it really is our intention and our great mission that there are many, many healthy people that maintain their health, and that really that the world becomes a healthier and happier place. So anyway, my love to both of you, Dr. Hoyer and Dr. Skul, and we'll continue this conversation another time. But for now, you all have just as I said, really laid out a very strong foundation for people to weather this time. So thank you so much. We'll see you all again.